Have you ever hesitated about which Tadalafil formula you should actually use? Is the 5 milligram daily pill better, or is the 20 milligram version that you take only on the day of intercourse the right choice? There is often significant doubt about which one functions better, which is more indicated for your specific situation, and most importantly, which is the safest way to use it. Stay with me until the end of this video. Today, I am going to explain the indications, the advantages, the disadvantages, and the risks associated with both formulations, the 20 milligram and the 5 milligram options. And I will explain exactly how medical professionals decide on the best treatment plan for each individual patient. Hello everyone. If you are new here, welcome to the channel for more health information. Today we are tackling a very common question. What is the best form of Tadalafil use? Is it the 20 milligram pill taken essentially on demand, or the 5 milligram pill taken every single day? Did you know that approximately 60% of Tadalafil users prefer and utilize the 20 milligram dose strictly for use on the day of sexual activity? In contrast, about 35 to 40% of individuals worldwide prefer the 5 milligram daily version. These are figures provided by the pharmacological industry globally and derived from studies published in major international journals. But ultimately, which formula should you choose? Which is better, 20 or 5 milligrams? To understand this, we first need to look at the medication itself. Tadalafil is currently the most prescribed medication in the world for the treatment of erectile dysfunction. The massive advantage of Tadalafil compared to other PDE5 inhibitors, those vasodilator pills used for erectile dysfunction, is that Tadalafil is the only one of these medications that can be utilized in two distinct ways: on demand, on the day of intercourse, or as a continuous daily treatment. This unique flexibility offers the patient greater naturalness in managing their erectile dysfunction and liberates them from the obligation of taking a pill moments before sex. However, making this choice isn't as simple as just picking a preference. It is not merely a question of what you like. We need to take several medical factors into account to determine the correct path. Specifically, we need to look at four main issues. First, the frequency of sexual activity of the couple. Second, the presence of urinary symptoms coming from benign prostatic hyperplasia, or BPH, which is the benign enlargement of the prostate. Third, we must investigate comorbidities like cardiovascular disease, diabetes, high blood pressure, or heart conditions. And fourth, we assess the risk of side effects. Now, while these medical treatments are effective for many, I know that relying on pills, dealing with side effects, or scheduling your intimacy isn't for everyone. If you're looking for a completely different approach, a bizarrely simple, all-natural home remedy that thousands of men are using to restore rock-hard erections without dangerous pills or pumps, you need to see this. I found a short video that reveals a powerful purple hardening tonic you can make at home in just 7 seconds. It targets the root cause of ED that most drugs just mask. Point your phone's camera at the QR code on the screen right now to watch the video and learn exactly how it works. I've also pinned a link to the top of the comments section below, so you can click it anytime. Go check it out. It might be the game changer you've been looking for. But for those considering Tadalafil, before we dive into the specific protocols, we also need to have a serious conversation about side effects and costs. Today we know that daily Tadalafil can actually have a cardioprotective benefit. There is a factor of endothelial improvement, protecting the lining of the blood vessels, which can improve quality of life and reduce morbidity and mortality in patients with vascular issues, potentially reducing risks associated with heart attacks or strokes. Before we dive into the specific protocols, we also need to have a serious conversation about side effects and costs. The higher dose of 20 milligrams is associated with a higher incidence of the main adverse effects. These include headache, nasal congestion, facial flushing, muscle pain, and back pain. The 5 milligram dose is generally much better tolerated. So, for patients who are more sensitive to medication, we usually indicate the lower dose to avoid these discomforts. Another issue is the cost of treatment. The price of a daily Tadalafil treatment at 5 milligrams, buying 30 pills a month, is generally higher overall than using it on demand occasionally. However, we always need to reinforce the importance of the quality of the medication being used. A very cheap generic medication where a box costs extremely little might have a different quality of raw materials compared to a premium brand or a more reputable laboratory. That difference can be substantial when it comes to your physiological response to the treatment. Now, let's identify the practical differences between the two, starting with the 5 milligram dose. The 5 milligram dose must be used daily, always at the same time, and preferably on an empty stomach. This form is primarily indicated for patients who want more naturalness regarding the sexual act itself. This is because it frees the patient from the obligation of using a pill on the specific day of intercourse. A patient on daily treatment can have spontaneous, high-quality erections without needing to take a dose 1 or 2 hours beforehand. Furthermore, this daily method is strongly indicated for patients suffering from urinary symptoms due to BPH. Daily Tadalafil also treats these conditions by improving urinary flow. It acts on the smooth muscle of the bladder and prostate, causing them to relax. It is important to note that it doesn't shrink the prostate size, but it releases the flow, improving bladder emptying. This makes it an incredibly important dual-purpose medication for men suffering from both erectile dysfunction and an enlarged prostate. And as I mentioned, it is the go-to choice for patients who suffer heavily from side effects, because the 5 milligram concentration keeps blood levels more stable, avoiding the sharp peaks that trigger headaches and congestion. Now, let's look at the 20 milligram dose used on demand. With this method, the man has the obligation to take the medication at least 60 minutes before intercourse. It is crucial to understand that Tadalafil does not work like a rapid analgesic. It doesn't have an instant effect of 10 to 15 minutes. You must wait a minimum window of 1 hour to see the main effect, with the peak action often occurring in 2 to 3 hours after ingestion. However, Tadalafil 20 milligrams has a massive residual effect of up to 36 hours. It used to be known as the weekend pill for this exact reason. You could take it on a Friday night, and the effects would still be present on Sunday morning. Therefore, this high dose is indicated for patients who do not mind the requirement of taking it on the specific day and, crucially, for those who have more spaced-out sexual activity. If a man has sex only once or twice a week, this might be the more economical and logical choice. However, because it is a higher concentration, it can bring more intense side effects. Those primary symptoms I listed earlier, headache, flushing, stuffy nose, are much more common with this spike in dosage. So, in clinical practice, how do we make the final decision? It essentially passes through 4 main filters. First is the frequency of sexual relations. If a man has a high frequency, defined as 3 or more times a week, he benefits significantly from the daily use of the medication. It removes the pressure of planning and allows for spontaneity. Conversely, for those with spaced-out relations, looking at 1 or 2 times a week, the on-demand use makes more sense financially and physically. The second filter is the presence of those urinary symptoms I mentioned. If you have a weak stream or trouble emptying your bladder due to an enlarged prostate, the daily 5 milligram dose is the superior choice as it treats both conditions simultaneously. The third filter is the tolerance to side effects. If you take the 20 milligram pill and get a splitting headache or severe back pain, migrating to the daily 5 milligram dose is the standard medical advice. The body adapts much better to the lower, constant dose. And the fourth filter is the severity of the erectile dysfunction itself. A case of severe ED often requires a higher dose to achieve sufficient rigidity. Therefore, a patient with severe dysfunction might benefit more from the punch of the 20 milligram on-demand dose. Meanwhile, for mild to moderate dysfunction, we can successfully propose the daily 5 milligram dose. Sometimes, for patients with very mild dysfunction, we might even suggest taking the 5 milligram medication on alternate days or every 2 days. Some patients respond very well to this tailored approach. Also, it is worth noting that nothing stops a patient on daily 5 milligrams from taking an extra booster dose on a specific day if they feel the need, taking 2 or 3 pills to reach 15 or 20 milligrams, provided this strategy is discussed with and approved by their doctor. Finally, I need to issue a very important warning regarding safety. Despite Tadalafil being a medication that is often easily purchased in pharmacies without a strict prescription check in some places, it is a medication with very strong vasodilator potential. It requires medical indication. There are patients who absolutely cannot use these medications. This includes cardiac patients with decompensated heart disease or, most critically, those using oral nitrates. Medications like isosorbide mononitrate, often used for chest pain, angina, act as potent vasodilators. If you mix nitrates with tadalafil, it can potentiate this effect and lead to severe hypotension, fainting, falls, and even death due to a cardiovascular event or stroke. Additionally, we must be aware of psychological dependence. Tadalafil does not cause chemical dependence. Your body does not get addicted to the molecule. However, using it without a real medical need can create a psychological crutch. You might start to feel insecure about performing without the pill, leading to performance anxiety when you aren't using it. So, the answer to which is better is, it depends. It depends on your sexual frequency, your prostate health, your tolerance to side effects, and the severity of your condition. Do not self-medicate. Talk to your doctor to analyze these 4 factors and make the best decision for your health and your lifestyle. If you found this information helpful, please share it with someone who might benefit from it. Don't forget to subscribe to the channel for more weekly content. See you in the next video.